Hello, my name is Angelina Hoyer, and I'm going to be doing my presentation on Down syndrome for the application of genetics to healthcare. Every cell in our bodies have genes that hold our genetic codes that we've inherited traits from our parents. These genes make up our chromosomes. Each cell normally contains 23 pairs of chromosomes. We inherit half from our mother and half from our father. Down syndrome occurs when there's an extra copy of chromosome 21. So as you can see in the picture, there's the karyotype of Down syndrome. On the 21st chromosome, there are 3. This happens due to abnormal cell division. This extra chromosome affects development of the individual and causes this genetic disorder. Often these patients suffer from varying degrees of developmental delays and intellectual delays. There are also many physical characteristics that are present with this disorder. We will discuss those in detail, and many comorbidities that are present with Down syndrome that we will also discuss. This is actually the most common chromosomal abnormality in live-born infants today. Down syndrome had been depicted in early art, literature, and science. However, it was not until the late 19th century that Langdon Down published a description of a person with Down syndrome, and he became the founder of this syndrome. In 1959, Jérôme Lejeune identified this as a chromosomal condition. He found that there were 47 chromosomes in each of the cells. Then, in 2000, scientists identified and cataloged each of the 329 genes on chromosome 21. This helped motivate research from this point onward. And you can see Jerome with Betsy Goodwin, the founder of the National Down Syndrome Society, in the picture. There are 3 types of Down syndrome. The first one is non-disjunction, and this is most commonly what they're referring to when someone says trisomy 21. So this is an error in cell division. The embryo has 3 copies of chromosome 21. The pair of 21st chromosomes falls into a separate sperm or egg cell, and an extra chromosome is replaced in every cell, replicated in every cell. This has a 95% occurrence rate. The second one has a 4% occurrence rate. It's called translocation, and this is when the total number of chromosomes is the normal 46. However, there is an additional copy of chromosome 21 that attaches to another chromosome. It's often 14, and you can see that in the picture on this slide. The third option is mosaic, and this is a mixture of 46 and 47 chromosomes in the body cells. The 47 ones contain the extra 21st chromosome. This is only 1% of cases, and they do tend to have fewer characteristics than the other types, just because they do have some normal cells. So Down syndrome is seen in all races and economic levels. Really, the only contributor to consistency we've seen is in maternal age. So the maternal factor is a factor in non-disjunction and mosaic type. And as you can see on the slide, maternal age at age 35 dramatically increases to 1 in 350 chance of having a baby with Down syndrome. So the trend right now is to have babies later in life, so we're expecting to see a rise in Down syndrome, and genetic counseling is available for those mothers having babies later. Down syndrome is actually only a genetic condition because of the chromosomal factor. Only 1% of cases are hereditary, and most are from chance. 1/3 of those cases are from a parent who is the carrier of the translocated chromosome, and that's only in the translocation type. There is a second child risk that increases if your first child has Down syndrome. Your second child risk increases to 1 in 100 of having Down syndrome. Now we're going to discuss the phenotypic features of Down syndrome. So there is a growth failure and cognitive disabilities. They do have tend to have a flat back of their head, abnormal ears. They're going to be low set and just kind of differently shaped. They're going to have many loop fingerprint on their tips and a palm crease, which is called a simian crease, which I'll show you a better picture of. There's special skin ridge patterns, a unilateral or bilateral absence of one rib. An intestinal blockage can happen, and that's actually called duodenal atresia. It presents with vomiting at birth. 1/3 also have Down syndrome when they have the duodenal atresia, and they will require surgery for that. An umbilical hernia, an abnormal pelvis, diminished monotone, that's very common. They're going to have a really relaxed tone. Facial features are broad, flat face, slanting eyes, epicanthial eye fold, and a short nose, which is also going to have a wide bridge. Short and broad hands, a small and arched palate, a big wrinkled tongue, which sometimes can be protruding, dental anomalies, congenital heart disease, that's a big one. We're going to talk about all the different heart conditions that they can be born with, an enlarged colon, and big toes. Here are some more images of the physical features. So you can see the baby on the left side has the flattened nasal bridge and the upslanting eyes with the epicanthial folds. Next to it, you can see a baby with really hypotonia, really relaxed tone. The hand picture shows the simian crease, so it's a crease that goes across the entire palm. And then you can see the neck folds and the extra skin on the back of the neck. The heart and Down syndrome. So heart abnormalities are very common with Down syndrome. 40 to 50% are born with problems. We'll talk about the most common types. So the first is the atrioventricular septal defect. This is when there are passaging of blood between the atriums and the ventricles. These also can occur separately and just have an atrial defect or a septal or a ventricle septal defect. The next is the persistent ductus arteriosus, the PDA. This is a hole to the pulmonary artery, resulting in increased blood flow to the lungs and not systemically. And the last one is tetralogy of Fallot. This one is a little more serious. It consists of 4 different abnormalities. It has the ventral septal defect also, and then the stenosis of the right ventricle, the enlarged right ventricle, and the enlarged aorta. So this one, along with many others, require surgery. The heart is so closely related to the lungs that there's an increased growth of blood vessels in the lung, or a decreased growth of blood vessels in the lungs, and this increases the pressure and blood flow to the lungs, which can cause labored breathing. So many times they will need respiratory therapy or treatments to assist their breathing, and you can see that baby has a nasal cannula on. Clinical presentations with Down syndrome can vary dramatically in severity. So mental health concerns when they're young, they can have ADHD, inflexible behaviors, chronic sleep difficulties, and fatigue. Then they reach school age to adolescence, and it often comes with depression, social withdrawal, anxiety, OCD behaviors, and regression in cognitive skills and sleep difficulty. As adults, the mental health concerns are similar: anxiety, depression, social withdrawal, and regression in cognitive skills, and eventually they can develop dementia. Down syndrome is the most common identifiable cause of intellectual debility, which 15 to 20% of the disabled population. So they do have motor development delays, and many meet developmental milestones later in life, such as walking or talking, and they also can have vision and hearing impairments. Down syndrome has variable penetrance and expressivity in appearance, cardiac concerns, etc. Many can have different levels of severity. The really only specific one that's nearly 100% penetrance is that their cognitive disabilities are specific to Down syndrome and the neonatal hypotonia. So IQ scores can vary from 20 to 69 or more on these individuals. Recent studies have tried to determine why the clinical presentation of Down syndrome can have so much variation. Studies on mechanisms of gene regulation showed that the genetic mechanisms listed on this slide may affect the variability of the phenotype. So these include gene expression, transcription factors on the chromosome 21 and elsewhere, copy number polymorphisms, function of non-genic regions, microRNA activity and RNA editing, and then DNA methylation can have a factor. We know that everyone with Down syndrome has an extra portion of chromosome 21, however the cause is still unknown. Maternal age correlation is the only factor we found to increase the risk. However, 80% of Down syndrome babies are born to mothers under 35, and that's just because that's when most women have offspring. No research has shown indications of environmental factors or activities during pregnancy causing this syndrome, and this can come from either the mother or father when it's hereditary. 5% of cases are originated to the father. Diagnosing Down syndrome can happen prenatally or after birth. Prenatally, we can screen to estimate the risk via a blood test or ultrasound. This is non-invasive and highly accurate. To diagnose prenatally, we need to do the chorionic villus sampling or an amniocentesis. These are both blood tests and they have a risk of miscarriage because they are so invasive, but they are 100% accurate. After birth, the physician will order diagnosis if they notice some of the physical features. Karyotypes confirm that is a mapping of all of their baby's chromosomes, and we would see the third 21st chromosome. Or they can do a FISH test, which also looks for 3 copies of chromosome 21, and this is a newer test and it's become quicker to confirm. So either one, the karyotype or the FISH, is what we do after birth. Unfortunately, there is no cure to Down syndrome, but there are treatments that we can do. So infants who need to receive a heart echo immediately if there's a problem with perfusion, breathing, or the doctor hears the murmur. Otherwise, at 2 months of age, all babies will receive a heart echocardiogram to check on their heart function. They should immediately start with speech therapy, as many times these babies have a difficult time eating. Some are unable to take enough by bottle before wearing out that they will need a gastrostomy tube. Physical therapy should also begin right away to help these infants with their tone and motor development. The therapies should also continue into childhood, speech therapy, physical therapy, and occupational therapy. Many Down syndrome children won't say their first words until age 2 or 3, so they will continue working with speech on that. And then occupational therapy will help the children develop independence with opening and closing things, playing with toys and stacking them, and working on knobs and buttons. The Individuals with Disabilities Education Act regulates early intervention, mandates schools to provide appropriate education for children with disabilities after they turn 3. Management for adults with Down syndrome includes screening and prevention just like everyone else. However, they do tend to have some of these diagnoses that might need treatment. So we screen them extra for thyroid disease. They can have hypo or hyperthyroidism, diabetes, hearing loss, depression or obsessive compulsive disorder, obstructive sleep apnea, spinal cord compression, dementia, or periodontal disease. It's important to always approach the individual with Down syndrome and not their caregiver first when screening for these disorders. Society has been improving on integrating people with Down syndrome into the community. However, this isn't always in an area we can improve on. So acceptance is so important to these individuals. Many have mild to moderate cognitive delays, which would allow them to still participate in school, workforces, and recreational activities. So we really just need to work on accepting, including these individuals, and being kind. Decreasing depression and social fear would come along with this. It's really important, and just having support for those parents and individuals with Down syndrome and connecting to them to support networks. So as far as social considerations go, we need to accept these individuals and help them integrate into the communities. Financial struggles for these families are very common. Diapers longer in these children because they take longer to potty train. There are numerous hospital appointments and co-pays that these families will have to pay. The therapy appointments for speech, physical, occupational, and mental therapy. And then medications and medical equipment are a necessity in these patients. They will need a caregiver most need a caregiver at all times, so parents are unable to return to full-time work. Disability benefits, the intention is to help, but sometimes they easily get absorbed into total family income, and this is another reason they struggle. Luckily, there are many organizations to try to help these individuals. Disability living allowance is given from birth to age 16. Then there's the carrier's allowance and the 1619 bursary fund for children 16 to 19. And then personal independence payments are given to disabilities with Down syndrome, people with Down syndrome, and this replaces the disability living allowance, so it's from age 16 to age 64. The lifespan of Down syndrome in 1910, children lived to only be 9 years old. Antibiotics began to play a role and they increased the living age from 9 to 20. However, after advancements in clinical treatment such as heart surgeries and advancements, we have now increased these lifespan of these individuals to live into their 60s. So now 80% live to be 60 plus. The future of Down syndrome. Scientists want to know why trisomy 21 arises and what causes Down syndrome when there is that third chromosome. We need to figure these things out so we can help lessen the occurrences. Cre-Lox-P technology has been used in mice to alter specific chromosome duplications, so this is something that scientists are looking into to help inactivate the extra chromosome. Other forms of transgenesis also exist, and I do think this is going to be an up-and-coming research for these patients with Down syndrome, and hopefully someday we can lessen the occurrence of Down syndrome, if not cure it for good. These are my lovely resources for this project. I encourage you, if you have any other questions, to go to the National Down Syndrome Society.org, and they have lots of information and resources on there. Thank you.